Hello, everyone. I just wanted to go over two quick papers here. First one, it's not really a paper, but these are preprints. The first one comes out of the University of Hong Kong, and basically in this video, in this paper, they show that in the bronchus, which is the upper airway, Omicron is much more prevalent than Delta, and the reverse is true in the alveoli, in deeper in the lungs. So what that means is the lung disease, the alveolus is where the actual air exchange happens in people, and that's where you breathe. And it's not it's the viral numbers are not as high there, indicating that the damage in the alveoli may be less. Whereas it's much more prominent in the bronchus, where the air exchange doesn't happen there, but that's where the air conduits are, which may indicate that's why it is more infectious, because there's more virus in the upper airway. This made this group of researchers at the University of Cape Town look at saliva, and it turns out that there is much more virus in saliva in Omicron than in Delta. When you test saliva with PCR for virus, in Delta, only 71% of the known positive uh, patients test positive using saliva versus 100% if you test their nasopharynx and their nasal cavity. Whereas in Omicron, 100% of the saliva um, had had positive PCR versus 86% of the mid-turbinate swabs, so middle nasal cavity swabs. So it means that there's a lot more virus in saliva. That's important because when eating and talking, we do spray out small microaerosols of saliva, and that is probably an indication that that is one of the reasons that Omicron is much more infectious, because it's present in saliva and the upper airways to a greater degree than Delta. This also means that saliva samples, which are very easy to get, may be a preferred method of testing for Omicron. So I will link both of these papers below. Please leave your comments, and thanks for watching.